Hi, my name is Lauren Hayes. I will be presenting my project proposal on educational intervention in treating diabetes management. Uncontrolled blood glucose is the #1 problem in patients with diabetes mellitus. However, planned educational interventions provides patients with knowledge and skills that allow them to achieve more successful metabolic control. Educational interventions are a way to promote healthy practices and part of the nursing and family nurse practitioner's duty in treating a diabetic patient. The objectives of my project are to decrease A1C levels from baseline to 12 months, to increase diabetes management and glycemic control in adults, to identify the effectiveness of educational intervention sessions, as well as follow-up sessions and educational reinforcement on diabetes management over a time period of 12 months. The significance of this project is that diabetes affects 29.1 million people in the U.S. and is the 7th leading cause of death, according to the CDC. Diabetes complications tend to be more common and more severe among people whose diabetes is poorly controlled, which makes diabetes an immense and complex public health challenge. This is why maintenance and management of the disease is very important for those that are diagnosed. There are 4 studies that I used to research for this project proposal. All 4 studies used educational intervention in order to manage glycemic control, and all 4 studies evaluated the outcomes using A1C measurement. However, 2 studies had stronger results in favor of the goals and objectives of my project, and these studies included 2 supplement interventions on top of the educational intervention, and that was follow-up sessions with a nurse and educational reinforcement. So this project will use all 3 interventions, and it will evaluate the results over a period of 12 months instead of 6 months in order to see if more positive results come from a longer time period. The effectiveness of education was examined in the 4 studies outlined in this proposal. Sindhu and J. Ukumar and Shahkabaza, Bartholomew, Rashidin, and Larajani demonstrated how important follow-up and the patient and education reinforcement was for effective treatment. It is because of the success of these 2 studies and patient follow-up is considered an important part of this project. If this project proves to be successful, family nurse practitioners and nurses can use these educational interventions and follow up in a clinical setting to aid patients in better self-care and improve glycemic control. I did place my Gantt timeline on this poster presentation, and it details the activities and how many months it would take to make this project happen, starting with securing project clinic location, gathering the team, planning for the project. We would have a team meeting at the beginning of the project, and then we would recruit patients. And from there, after the patients are recruited, we would have an informal informational meeting for the patients. They would get A1C baseline testing. Then the educational sessions would begin, 1 every month for 12 months. And then the nurse follow-up would begin, and that would be 2 times a month on top of the educational sessions. And these would just be times where the nurse would reinforce what they taught in the educational sessions and answer any questions that the patients have. Next would be the 6-month A1C testing, a checkpoint at 6 months, and then the 12-month A1C testing. And last, there is a month on there set aside just to evaluate the results. My outcome measures results will be evaluated by determining the average A1C at each checkpoint, baseline, 6 months, and 12 months, and then finding the difference between each average and then my successfulness will be determined by comparing these differences to the 4 research studies previously conducted and what was considered significant. I also included my evidence synthesis table for the 4 research studies on my poster presentation. As you can see, all 4 studies used diabetes education. Only 2 of the studies used follow-up and education reinforcement, and those are the 2 studies that had the most significant results and the strongest results in favor of my objectives. There were also 2 studies that used group atmosphere, but that did not seem to be an intervention that made any of the studies significant, more so one way or the other. Thank you for listening to my project proposal. I do have my references on my poster as well. If you have any questions, please ask me through discussion board, and thank you again for viewing my project.